Okay, so picture this. Linda and Rob, they've just left the preconception appointment, right?
Uh-huh.
They are so excited about starting a family.
Yeah.
But they walk out,
Yeah.
and it feels like they're carrying this mountain of information about pregnancy.
Yeah.
Like, have you ever felt like that? Just completely overwhelmed by all these new details.
Oh, absolutely, yeah.
Well, that's kind of what we're going to be diving into today.
That's it, yeah.
But specifically for this deep dive, we're focusing on a really crucial area, nursing management during pregnancy.
Yes.
And we're aiming to really extract the most vital knowledge, the core insights that student nurses and faculty need to grasp. We've been looking at a lot of nursing literature, and our goal is to sort of pull out the most important pieces without, getting
bogged down
in the weeds. Exactly.
Absolutely.
We don't want anyone to feel lost in a sea of medical jargon.
Yeah.
Our aim is clarity. We want to give you a really clear and concise understanding of what's most important in caring for pregnant people, right?
Yeah.
We're talking about what to consider before pregnancy even starts. How to navigate those common discomforts that pop up, and understanding the key assessments that nurses perform. So, are you ready to kind of unpack all this?
Oh, I'm ready. Let's go.
Okay.
And I think it makes perfect sense to start at the very beginning, even before conception actually happens. So preconception and interconception care.
Okay.
Yeah. It might sound kind of technical, but the basic idea is really pretty straightforward, Being as healthy as possible before pregnancy can really make a huge difference in increasing the chances of a positive outcome.
Yeah.
And it's not just a one-time thing. This whole focus on health extends throughout, a person's reproductive years.
So it's not just about one appointment.
No, not at all.
It's about this ongoing process.
Exactly, yeah.
And, health organizations have actually put out guidelines for this kind of care. And a few things really stuck out to me. The first one is the idea that everyone, individuals and couples, should think about having a reproductive life plan.
Absolutely.
It's about being proactive, planning ahead.
Yeah, and I think that's such a key point, It's about encouraging people to think about their reproductive goals and plan accordingly.
And then there's this emphasis on, really raising awareness in the community.
Yes.
About why these preconception health behaviors and services are important.
Yeah, it's about education. It's about making sure people have the information they need to make informed decisions.
Okay, so what else did you find interesting in these guidelines?
Well, one thing that really stuck out to me was the emphasis on those initial preventive visits, where healthcare providers can assess for any potential risks and also offer crucial education for anyone who could become pregnant.
It's like a proactive approach.
Exactly. And crucially, they talk about interventions, like actually taking action based on the risks that are identified.
So it's not just about gathering information, it's about doing something with it.
Precisely.
That's so important.
Absolutely.
Okay, what else?
Well, there was also this focus on what they call interconception care. And what that really means is using the time between pregnancies to offer that extra support.
Okay.
Especially for individuals who've had a previous pregnancy, perhaps, with an adverse outcome, like an infant death or a preterm birth.
Yeah.
It's really about learning from what happened and trying to, do things differently and improve outcomes for future pregnancies.
It's almost like, you had that experience, let's learn from it and let's move forward and try to, prevent that from happening again.
Exactly, yeah.
So if we connect this to the bigger picture, we can see why this kind of proactive approach to preconception care is so critical.
Right.
Statistics show that a significant number of infants are born prematurely or with low birth weight. And, a lot of people experience complications during pregnancy.
And that's really why this focus on preconception care is so crucial. We know that there are certain things that can be done to help prevent these complications.
It's really about prevention.
Absolutely.
Okay, so let's delve into some of the specific risk factors that you came across in the literature.
Okay, sure. So one of the things that really struck me was the discussion around certain medications. Like isotretinoins, which are used for acne.
Oh, right, yeah.
And these can actually cause serious birth defects.
So that's something that needs to be addressed before pregnancy.
Absolutely. And then, of course, there's alcohol misuse, which, as we know, can lead to a whole range of developmental issues in babies.
Fetal alcohol spectrum disorder.
Yeah.
That's a big one.
It is. And, these are areas where education and awareness before pregnancy can really make a world of difference.
It's about empowering people to make informed choices.
Exactly.
Okay, so what about other risk factors?
Well, the source material also talked about medications used for epilepsy and the importance of adjusting dosages before someone even tries to conceive. It's about having those conversations early on so individuals can work with their doctors to make sure their medication plan is optimized for pregnancy.
So it's safe for them and for the baby.
Exactly, yeah.
Okay. What else did you find?
Well, managing diabetes before pregnancy is another really crucial one.
Right.
Getting blood sugar levels well controlled before conception can significantly reduce the risk of birth defects.
So that's another really important point.
It is. It's empowering for people to know they can take an active role in protecting their baby's health, even before they get pregnant.
I like that, taking an active role.
Yeah.
Okay. Anything else on your list?
Let's see. Oh, yeah, there's folic acid.
Oh, that's a big one.
It is, and it's actually quite concerning. A large percentage of women of childbearing age don't take folic acid supplements.
And we know it's so important.
Exactly. It can dramatically reduce the risk of neural tube defects, like spina bifida.
And it's a simple intervention, a simple supplement.
It is. It's such a powerful example of preventative care.
Yeah. What else did you come across?
Okay, so making sure someone is immune to rubella before pregnancy is another crucial one.
Right.
That can prevent congenital rubella syndrome, which can have some really serious consequences for the baby.
Okay.
Anything else?
Well, obesity is another one that's often mentioned.
Okay.
And, with obesity, there are links to so many complications during pregnancy, like high blood pressure, diabetes, and a higher likelihood of needing a cesarean section.
Right.
These are all areas where preconception counseling can be so valuable.
It can make such a difference. Okay, what else?
One more. We can't overlook sexually transmitted infections.
Right.
There's a very significant connection between STIs and a range of issues like ectopic pregnancy, infertility, chronic pelvic pain, and even fetal death and developmental disabilities.
So those need to be addressed.
Absolutely. Early screening and treatment are essential. Okay, so given all these risk factors and the importance of preconception care, what does this mean for nurses? What is their role?
Well, I think nurses are really at the forefront of this.
Okay.
Their role is incredibly comprehensive. It starts, of course, with identifying those risk factors we've just been talking about.
Right.
But it goes beyond just identifying them. It's about actively encouraging people to adopt healthier behaviors.
So it's like, okay, we've identified this risk. Now let's talk about what you can do about it.
Exactly. And it's also about taking a really thorough health history. And not just from, the person who could become pregnant, but also from their partner.
Right.
To really get that complete picture of any potential risks or influencing factors.
Because, the partner's health can also impact the pregnancy.
Absolutely, yeah.
Okay, so what else is involved in nursing management?
Well, making sure those immunizations are up to date seems basic, but it's incredibly important.
Yes.
And then helping people to create those reproductive life plans that we talked about earlier.
Right, that proactive planning.
Exactly.
Okay, so what else?
Let's see. Taking thorough medical and genetic histories to identify any potential inherited conditions. Nurses also play a key role in, talking sensitively about STI history and any high-risk behaviors that might be relevant.
Right. It's about creating a safe and non-judgmental space.
Absolutely. And getting information about diet, offering nutritional guidance, making sure they're getting all the nutrients they need.
It's really a holistic approach, isn't it?
Very much so, yeah.
It's not just about the physical aspects. It's about the emotional, the social, the mental.
Exactly.
Okay, so what else is involved in this holistic approach?
Well, encouraging people to get regular exercise, appropriate for their fitness level, emphasizing, the importance of that folic acid that we talked about, and encouraging people to, aim for a healthy weight.
Right. And what about potential hazards in the workplace? I hadn't really thought about that before.
Yeah, that's another really important piece of the puzzle. Asking about potential exposure to chemicals, radiation, things like that, and providing information on how to minimize those risks.
So if someone's working in a healthcare setting, for example, they might be exposed to certain medications or infections?
Exactly, yeah. Or if they're working in a factory, they might be exposed to chemicals or loud noises.
Right. So the work environment can definitely have an impact.
Absolutely.
Okay. What else is on the list?
Well, let's see. We can't forget about talking to people about substance use,
Right.
including things like smoking, alcohol, and drug use.
Yeah.
And, identifying if someone is experiencing intimate partner violence.
Right. That's so important.
And connecting them with appropriate resources and support.
Yeah, because that can have a significant impact on the pregnancy as well.
Absolutely.
Okay. Anything else?
Let me see. Oh, yeah. Managing any chronic health conditions that someone might have.
Okay.
Things like asthma, diabetes, high blood pressure.
Right.
And educating people about potential environmental hazards.
Like lead paint, for example, or mold.
Exactly, yeah.
So it's really about looking at the whole picture, isn't it?
It is. Yeah. And it's also about offering information about genetic counseling.
Okay.
And connecting people with relevant support systems.
Okay.
Like social workers, dietitians, whatever they might need.
It really seems like it's all about building a collaborative partnership.
It is. It's about working with the individual and their partner, really empowering them to understand their own health and how it might impact a future baby.
So it's not just about telling them what to do. It's about giving them the information and letting them make their own decisions.
Exactly. It's about providing information so they can make informed decisions. Ultimately, the decision to have a child rests with them, but our role is to really equip them with the knowledge they need.
Yeah. That's a really important distinction. And the source material had a really important takeaway from major health organizations, the ACOG and the SMFM. And they basically said that this preconception and interconception care shouldn't be seen as like these isolated events.
Right.
But as an ongoing part of preventative health for all individuals of reproductive age.
Yes, I agree. I think that's a very powerful message.
Yeah. It's not just about when you're trying to get pregnant.
No, it's about taking care of your health throughout your reproductive years.
Okay, so let's shift gears a bit and talk about what happens when someone actually comes in for that first prenatal visit.
Okay, sounds good.
That initial visit, it can really set the tone for the whole pregnancy, can't it?
Absolutely.
So the atmosphere must be super important.
Oh, it is. A supportive and knowledgeable nurse can really make all the difference in helping someone feel comfortable.
Yeah.
And confident. And, a huge part of that first visit is gathering a really comprehensive health history.
Okay.
And we're talking about everything: age, menstrual history, any previous pregnancies, any medical or surgical history.
And psychological screening is also a key part of that, isn't it?
Absolutely, yeah. Pregnancy can have a significant impact on mental well-being. So, asking about things like mood, any history of anxiety or depression, any current stressors.
Oh, so important.
Yeah.
Okay. What else is covered in that health history?
Let's see. Family history, genetic history, and any conditions that run the family, dietary habits, lifestyle, any medications they might be taking, or any substance use.
Okay.
And then, of course, that sexual history and STI history that we talked about earlier.
Right.
It's a very in-depth process.
Yep.
And a lot of clinics will actually use standardized forms to help gather all of this information. It helps make sure that nothing important is missed.
That makes sense. And then, of course, the big question is, why are they seeking care?
Yeah.
So most often, it's because of a missed period, right?
Yeah, right.
Or a positive home pregnancy test.
Exactly. And at this point, the nurse will also want to know the date of their last normal menstrual period, or LMP.
That's where Nagel's rule comes in.
Exactly.
So I remember learning about this in nursing school.
Yeah.
It's basically you take the first day of the LMP, subtract 3 months, and then add 7 days.
Right.
But it's important to remember that this is just an estimation, right?
It is, yeah. It's based on a 28-day cycle. So if someone has irregular cycles, it might not be as accurate.
And that's where an early ultrasound can be really helpful.
Exactly.
Okay. So along with figuring out the due date, getting a detailed obstetric history is also really important, right?
Yes, absolutely. It tells us about any past pregnancies, any complications that might have occurred.
And there are some specific terms that are used here, like gravida and para.
Right.
So gravida refers to the total number of pregnancies someone has had, including the current one.
Yeah.
So someone who's never been pregnant is nulligravida. Pregnant for the first time is primigravida. And multigravida means they've been pregnant more than twice, okay? And then para refers to the number of times a person has given birth to a fetus that's at least 20 weeks gestation.
Yeah.
Regardless of whether the baby was born alive or stillborn.
Right. And it's important to note that multiple births, like twins, still count as one birth event.
Okay, good clarification. So nullipara means they haven't had a birth past 20 weeks.
Yeah.
Primipara means they've given birth once.
Right.
And multipara means they've had 2 or more.
Exactly.
Okay, so that gives us a basic understanding. And then there's the GTPL system.
Yes.
Which gives us even more detail.
It does. It stands for gravida, term births, preterm births, abortions, and living children.
So term births are those that happen between 38 and 42 weeks.
Yeah.
Preterm births are those that happen between 20 and 37 weeks.
Right.
And abortions are any pregnancies that end before 20 weeks. And that includes miscarriages and elective terminations.
Yeah, that's an important distinction.
Okay. So we've got all this information about past pregnancies. Now let's move on to the physical exam. What are some of the key things that the nurse will be assessing during that first prenatal visit?
Well, it's a very thorough exam. It
Right.
starts with the breasts. So the nurse will be looking at things like symmetry, any changes in color, if there's any increased fullness or tenderness, any lumps or bumps.
So, like, are the breasts growing equally?
Exactly.
Are there any, like, visual changes that we can see?
Yeah, and stretch marks might start to become visible as the breasts grow.
Okay, what else?
The nipples and the areola, the area around the nipples, often darken during pregnancy. And the Montgomery glands, those little bumps around the areola, they become more prominent as well.
Oh, right.
The nurse will also note if there's any colostrum present.
Colostrum, that's the early breast milk.
Yeah, it's like a pre-milk, really. It's very high in antibodies and nutrients.
Okay, and it's important to remember that for some people, colostrum can start to leak out even in the first trimester.
It can, yeah. And that's perfectly normal. It doesn't necessarily mean anything's wrong.
Okay, good to know. And, this might also be a good time for the nurse to remind people about breast self-exams, especially if they have a higher risk history.
Absolutely. It's important for people to be familiar with their own breasts so they can notice any changes.
Okay, so we've talked about the breasts. What about the abdomen?
Okay, so with the abdomen, the nurse will be looking for things like stretch marks, any scars, the overall shape and size of the abdomen, and the linea nigra.
The linea nigra, that's that dark line that sometimes appears down the middle of the belly.
Exactly.
Oh, yeah.
And they'll use palpation to assess if the abdomen feels appropriately soft and non-tender. And as the pregnancy progresses, measuring the fundal height becomes really important.
Fundal height, that's the distance from the pubic bone to the top of the uterus?
Yeah, and it's basically a way to track the baby's growth. Around 12 weeks, the uterus is usually palpable just above the pubic bone.
Okay.
By 20 weeks, it's usually at the level of the belly button, and that's about 20 centimeters. And then by about 36 weeks, it's usually just below the rib cage, about 36 centimeters.
So the fundal height measurement should roughly correspond to the number of weeks of pregnancy.
Yeah, more or less, until about 36 weeks. After that, it can vary a bit more.
Okay. And is there anything else the nurse is looking for when they're examining the abdomen?
Yeah, they'll also be paying attention to the shape of the uterus. It should maintain a rounded shape throughout the pregnancy.
Okay. And what about the extremities?
So with the extremities, the nurse will be looking for any swelling in the hands, legs, and feet. They'll check the pulses in the feet and legs and look for any varicose veins.
Now, I know some swelling is normal during pregnancy, right?
Yeah, especially later on as your body retains more fluid. But if there's a lot of swelling, especially early in the pregnancy, or if it's accompanied by other symptoms, it could be a sign of preeclampsia.
Preeclampsia, that's a serious condition that can develop during pregnancy.
Exactly. So it's important to monitor swelling carefully.
Okay. And what about those varicose veins? What causes those?
Well, pregnancy hormones can relax the walls of the veins, making them more prone to swelling. And then the growing uterus puts pressure on the veins in the legs, which can also contribute.
And is there anything people can do to prevent or minimize varicose veins?
Yeah, wearing support hose can help. And trying to avoid standing or sitting for long periods of time.
Good advice.
Yeah.
Okay, what else is the nurse checking when they're looking at the extremities?
They'll also ask about any pain in the calves, especially pain that gets worse with walking. That could be a sign of a blood clot, which is a risk during pregnancy.
And those can be dangerous.
They can be, yeah.
Okay, so we've talked about the breasts, the abdomen, and the extremities. Now let's talk about the pelvic exam.
Okay.
I know this can be a little bit anxiety-provoking for some people.
Yeah, it can be, but it's a really important part of the prenatal checkup.
So what can people expect during a pelvic exam?
So the first part of the exam is a visual inspection of the external genitalia. So the nurse will be looking for any lesions, any unusual discharge, any swelling, varicose veins, things like that.
And they might take some cultures at this point.
They might, yeah, for things like STIs.
Okay.
Then, using a speculum, the nurse will examine the internal genitalia. So the cervix, which is the opening to the uterus, should appear smooth, long, firm, and closed. The nurse will also be looking for some key signs of pregnancy.
Like what?
Well, the cervix typically softens during pregnancy, which is called Goodell's sign. And the lower part of the uterus also softens, which is called Hagar's sign. And then there's Chadwick's sign, which is that bluish color of the cervix and vaginal walls.
And that's all due to the increased blood flow to the area.
Exactly.
So pretty amazing how the body changes during pregnancy.
It is.
What about the uterus itself?
So the nurse will be assessing the uterus to see if it feels pear-shaped, how easily it moves, and if the surface feels smooth. And they understand that it's going to be growing significantly throughout the pregnancy.
Okay. What else is done during the pelvic exam?
So a pap smear is usually done to screen for cervical cancer.
Right.
And cultures for gonorrhea and chlamydia are also typically taken. And it's really important to make sure all the samples are correctly labeled.
Yes, very important.
And then a rectal exam is often done last to check for any abnormalities in the rectum.
Okay, so that's the pelvic exam. And I know the source also mentioned pelvic measurements.
Yeah, they did. While it's not always necessary to do specific pelvic measurements, particularly for someone who's had a vaginal birth before, it can be important in certain situations.
Okay.
Like, for a first-time mom, assessing the size and shape of the pelvis can help determine if the pelvic opening is large enough for the baby's head to pass through during labor.
So they're basically trying to see if a vaginal delivery is likely to be possible.
Exactly.
And there are different shapes of pelvises, right?
There are, yeah. The gynecoid shape is generally considered the most favorable for a vaginal birth.
Okay.
So if the pelvis is more heart-shaped or oval-shaped, it might make vaginal delivery more challenging.
Interesting. So they're really looking at the anatomy to see if everything is kind of lining up for a smooth delivery.
Yeah, basically.
Okay, so we've covered the physical exam. Now let's talk about the lab work. There are a lot of different tests that are done during pregnancy, right?
Yeah, there are quite a few. So a complete blood count, or CBC, is usually done to check for anemia, infection, and how well the blood clots.
And then blood typing and checking the Rh factor are also important.
Yes, that's to identify any potential blood incompatibility issues between the mother and the baby. And it helps determine if the mother will need an injection of Rogam.
Rogam, that's a medication that can prevent problems if the mother is Rh negative and the baby is Rh positive.
Exactly.
Okay. What other lab tests are typically done?
So a urine sample is usually checked for protein, glucose, ketones, and signs of a urinary tract infection. Tests for rubella immunity, hepatitis B, HIV, and syphilis are also standard.
Okay.
And depending on the mother's ethnic background, a test for hemoglobin abnormalities might also be recommended.
Like sickle cell trait.
Exactly.
Okay, so those are some of the routine blood and urine tests. And then there's some screening tests as well, right?
Yeah, there are a few. So one of the most common ones is the multiple marker screening, which includes things like alpha-fetoprotein, HCG, estriol, and inhibin A.
Does that sound familiar?
They might. They're used to screen for things like neural tube defects, Down syndrome, and trisomy 18.
And glucose screening is also done.
Right. That's usually done between 24 and 28 weeks to check for gestational diabetes.
Gestational diabetes, that's diabetes that develops during pregnancy.
Exactly.
Okay. And then what about group B strep?
Yeah, GBS is a type of bacteria that can sometimes be present in the vagina, and it can cause serious problems for the baby if it's passed on during labor.
So that's usually tested for closer to the due date.
Yeah, usually between 35 and 37 weeks.
Okay. And it's important to remember that these screening tests are just that, screenings.
Yes, they're not diagnostic tests.
So if a screening test comes back positive, it doesn't necessarily mean there's a problem.
Exactly. It just means that further testing is needed to confirm or rule out a diagnosis.
Okay, good point. So we've talked about that initial prenatal visit and all those assessments. Yeah. Now, what about the follow-up visits?
So for an uncomplicated pregnancy, the typical schedule is to have visits every 4 weeks, up to 28 weeks, then every 2 weeks from 29 to 36 weeks, and then weekly after that.
Okay.
And at each of these visits, the nurse will check the blood pressure, weight, do a urine test, measure the fundal height, and listen to the baby's heart rate.
So it's like they're monitoring things to make sure everything is progressing normally.
Exactly.
Okay. And what about gestational diabetes screening? We talked about that earlier.
Right. So that's typically done around 24 to 28 weeks. but it might be done earlier if the mother has certain risk factors.
Risk factors like what?
Things like obesity, older age, family history of diabetes, a history of gestational diabetes in a previous pregnancy, or belonging to certain ethnic groups that have a higher risk. Okay. The initial screening usually involves a glucose challenge test, where the mother drinks a sugary drink and then has her blood sugar checked an hour later.
And if her blood sugar is too high, then she'll need to have a more comprehensive test.
Exactly.
Okay. And what about edema? I know that swelling is common in pregnancy, but is there anything specific that the nurse will be looking for?
Yes. So between 29 and 36 weeks, the nurse will be paying close attention to any swelling in the face, hands, and lower legs. While some swelling in the feet and ankles is common in the third trimester, swelling in other areas could be a sign of a more serious problem.
Like preeclampsia?
Right.
Okay. And what about that RhoGAM injection that we talked about earlier?
So if the mother is Rh negative, she'll usually get a RhoGAM injection around 28 weeks.
Okay.
And then again after delivery if the baby is Rh positive.
To prevent those antibodies from forming.
Exactly. And the nurse will also be asking about any signs or symptoms of preterm labor at each visit.
Preterm labor, that's labor that starts before 37 weeks.
Right.
Okay. And are there certain things that make preterm labor more likely?
Yeah, there are some risk factors, like having a history of preterm birth, certain infections, smoking, and being pregnant with multiples.
Okay, so they'll be keeping a close eye on that.
Yeah, and they'll be monitoring the fundal height at each visit as well.
Right, we talked about that earlier. And you said that it should roughly correspond to the number of weeks of pregnancy.
Yeah, up until about 36 weeks. After that, it can vary a bit more.
Okay.
But if the fundal height isn't increasing as expected, or if it suddenly increases a lot, it could be a sign that something's not right.
Like what?
Well, it could mean that the baby isn't growing as expected, or that there's too much amniotic fluid, or it could be a sign of a multiple pregnancy.
Oh, wow. So it's